Unit 1, Hospital Staff. Exercise 5, page 5.
Where do you need to go? Mercy Heart Hospital Directory. First floor, Robert Gibbons, receptionist. C4, visitor information, main lobby. Dr. Frank Fabrizio, radiologist. C4, X-rays, MRI scans, room 113. Lisa Kirby, lab technician. C4, analysis, test results, room 125. Susan Devlin, pharmacist. C4, prescription drug pickup, room 129. Second floor, Dr. Leslie Gupta, cardiologist. C4, heart disease, heart surgery, room 231. Dr. Terry David, pediatrician. C4, children's health, room 200. Third floor, Dr. James Lautner, anesthesiologist. C4, surgery pain relief and preparation, room 312. Dr. Stacy Walters, chief surgeon. C4, surgical procedures, room 323. Fourth floor, Dr. Jared Cho, general practitioner. C4, general medicine, room 403. Dr. Regina Beverly, obstetrician. C4, pregnancy, room 408.
Unit 2, Hospital Departments. Exercise 5, page 7.
Construction notice. St. Sebastian's Hospital wants to give its patients the best care possible. In order to do this, we need to update our facilities from time to time. As a result, we are starting some construction projects today. Some departments are temporarily moving during construction. The cardiology department is now in the basement across from the radiology and pathology departments. Obstetrics is on the second floor next to pediatrics. Access to other departments is limited. The entrance to orthopedics is now through the dermatology department. The surgery wing of the hospital is only accessible through the lobby elevators. The emergency room and the pharmacy are unaffected.
Unit 3, Rooms and Equipment. Exercise 5, page 9.
Longman Hospital, room checklist. Be sure that the following items are addressed before each patient is admitted. Sign and date after preparing the room. Check that a wheelchair is present. Test call button to ensure proper functioning. Make sure an oxygen tank is present and at least 80% full. Check that the alternating pressure mattress is working properly. Discard used hospital gowns and restock bedside table with new ones. Make sure drawers are stocked with latex gloves and gauze. Discard used syringes in Sharp's container and restock drawer with new syringes. Empty and clean biohazard waste container. Room prepared by. Date.
Unit 4, The Body. Exercise 5, page 11.
Hospital Treatment Guide. Assessing new patients. 1. Approach the patient to assess the injury. Ask where the pain is. 2. Check for a pulse in unresponsive patients. Place your index and middle finger on the left wrist. 3. Look around the patient's body for external injuries. This includes swelling, bruises, and bleeding. 4. Feel around with your hands for bumps in the arms, legs, and extremities. Bumps suggest an internal injury like a broken bone. 5. Elevate the legs above the heart in cases of leg swelling or fainting. 6. Do not move patients with potential spinal injuries. Keep the patient's head in place. 7. Use first aid to treat any external injuries.
Unit 5, Parts of the Body 2. Exercise 5, page 13. Jefferson General Hospital. Patient name, Doug Robinson. Sex, male. Age, 27. Physician, Dr. Robert Moody. Time, 9:42. Incident or reason for ER admittance. Automobile accident. Apparent injuries. Head and neck. The patient suffered minor head trauma and may have a concussion. There is no visible injury to the neck. Torso. There are several small scratches on the chest and waist. I observed bruising on the abdomen and the rib cage. There is no damage to the legs or groin. Posterior torso. The patient complains of pain below the right shoulder blade. He also has a deep cut on the small of his back. Arms and legs. The patient's arms and legs appear in good condition.
Unit 6, the circulatory system. Exercise 5, page 15.
The circulatory system. The circulatory system pumps nutrients and oxygen around the body. Blood lacking oxygen enters the right atrium of the heart through the vena cava. The heart pumps this blood through a valve and into the right ventricle. It travels through pulmonary arteries to the lungs and receives oxygen. It travels back to the heart through pulmonary veins. The heart pumps the blood out through the aorta. It flows through capillaries in the body and delivers oxygen. The blood travels back through veins and the cycle repeats. But sometimes disruptions in the cycle occur. The heart may not pump blood effectively. This is called an arrhythmia.
Unit 7, the respiratory system. Exercise 5, page 17.
Smoking. Know the risks. Your respiratory system is important. The oxygen you need gets to the lungs through the bronchial tubes. Alveoli in the lungs give oxygen passage into the bloodstream. It also removes toxic carbon dioxide from your body. Smoking damages every part of this process. Smoking can lead to emphysema. This disease destroys alveoli. This impairs their function, makes breathing difficult, and raises carbon dioxide levels. Smoking may also cause lung cancer. The lungs' epithelial cells start growing uncontrollably. Smoking can hurt the people around you, too. Research suggests inhaling secondhand smoke is a leading cause of asthma. Asthma sufferers' bronchial tubes swell, making breathing difficult. Not smoking or quitting can decrease your chances of developing these diseases.
Unit 8, the digestive system. Exercise 5, page 19.
Patient, Virginia Hansen. Physician, James McEnroy, MD. Reason for visit. Virginia is complaining of sharp stomach pain and cramping. She is also experiencing occasional diarrhea. Examination notes. I find no evidence of throat or esophagus problems. I also do not think it is likely that the patient's discomfort is from an ulcer. It is possible the patient has appendicitis. The conducting of further tests is needed to narrow the possible causes of the patient's discomfort. Recommendations for treatment. I am recommending a colonoscopy to rule out any damage to the colon. This procedure is to include an inspection of both the small intestine and her large intestine as well.
Unit 9, physical assessment. Exercise 5, page 21.
Conducting a physical assessment. Below are instructions for conducting a physical exam. They detail how to collect subjective data and objective data from a patient. 1. Introduce yourself and obtain verbal consent to perform the exam. 2. Collect demographic data. This includes the age and sex of the patient. 3. Collect information about the patient's general appearance. Assess body build and affect. 4. Perform an inspection of skin, hair, and body. Check for any abnormal spots. 5. Perform palpation of skin and abdomen. Check for pain or tender areas. 6. Perform auscultation of the patient's heart and lungs. Check for any irregular sounds. 7. Perform percussion of the patient's abdomen and chest.
Unit 10. Recognizing symptoms. Exercise 5, page 23.
Cold or flu? Know the difference. It's flu season again. Knowing the difference between the flu and a cold saves lives. It's easy to get confused because a stuffy nose, sneezing, and sore throat are all symptoms of both diseases. Review the following conditions and symptoms to tell the difference. With colds, patients get moderate cases of coughs at the worst. With the flu, coughing can become quite severe. The flu also causes severe aches and fatigue. Strong headaches are a common flu symptom as well. In colds, these symptoms are usually mild. Colds rarely cause a high fever. In the flu, however, a high fever is one of the disease's main characteristics. Remember, early diagnosis of the flu saves lives.
Unit 11. Pain. Exercise 5, page 25.
Pain assessment sheet. Patient's name, Tom Rempel. Age, 34. Room, 17B. Physician, Dr. Daniel Newell. Nurse, Stacy Rose, RN. Please describe the location of the pain. Left knee area. What causes or increases the pain? Bending, squatting, walking. Please describe the intensity of the pain. For example, mild, moderate, excruciating, unbearable. Excruciating. Please describe the frequency of the pain. For example, occasional, intermittent, constant. Intermittent. Please describe the qualities of the pain. For example, sharp, shooting, burning, throbbing. Sharp. Please describe the impact of the pain. For example, crying, anger, distress, depression. Distress.
Unit 12. Medication. Exercise 5, page 27.
November 5th. Westbrook Hospital, patients and medication. Review today's list of patients and their medications. Administer the drugs at the stated times and check each patient off the list. Administered. Seth Banks, room 103. 1 dose of painkillers, 120 milligrams at 11 a.m. Frank Klein, room 101. Sedative 25 milligrams at 9 p.m. Kate Ford, room 114. Anti-inflammatory 125 milligrams twice a day at 8 a.m. and 4 p.m. Tim Hunt, room 102. Stimulants 75 milligrams at 3 p.m. daily. Ted Hurst, room 118. 2 doses of antihistamines, 250 milligrams at 10 a.m. and 6 p.m. Erica Neal, room 120. Antibiotics 200 milligrams daily at 7 a.m. Ed Parson, room 105. Laxative 50 milligrams in the form of a suppository at 11 a.m. Jack Singer, room 100. Antidepressant 175 milligrams daily at 9 a.m.
Unit 13. Licensed Practical Nurse. Exercise 5, page 29.
Mercy Heart Hospital. Position available. Mercy Heart Hospital needs a talented and certified licensed practical nurse, LPN. This position requires both a degree and a license from an accredited school. LPNs are responsible for creating smooth and efficient patient flow. Along with helping doctors, they provide routine bedside care for our patients. This includes, but is not limited to, feeding patients, giving injections and vaccines, and checking for bed sores. They also collect and deliver samples for labs. LPNs are required to complete administrative tasks. Experience using and organizing electronic health records is vital. Additionally, LPNs complete weekly reorders for supplies. Send your resume to lucyronald@mercyheart.com to apply.
Unit 14, Registered Nurse. Exercise 5, page 31.
Trouble in the world of nursing. Chicago. Licensed nurses are in high demand across the country. Unfortunately, this shortage of nurses threatens the quality of patient care. Experts believe the biggest factor leading to this shortage is a lack of nursing degree programs. Some registered nurses get an associate's degree or a bachelor's degree, but such degree programs are rare. Others complete hospital-based diploma programs. These programs are too small, however, to train large numbers of nurses. Furthermore, after getting a degree, nurses take a difficult licensure exam, NCLEX-RN, from the State Board of Nursing. Finally, they have to follow their state's NPA, Nurse Practice Act. Such restrictions are preventing more nurses from entering the workforce.
Unit 15, Nurse Practitioner. Exercise 5, page 33.
Nurse practitioners and primary care. It's a familiar scene. Long waits at the doctor's office in crowded waiting rooms. But there's a way to avoid this and still get your checkup. How? See an NP, nurse practitioner, instead. NPs are an excellent point-of-entry health providers. They hold advanced degrees and must be board certified, so you're sure to get good care. NPs provide a wide range of services. They conduct physical exams and diagnose illnesses. They prescribe treatment such as physical therapy. Many provide regular immunizations for children. Some even offer counseling services. Though patients must see doctors for specialized care, nurse practitioners provide general health care without the wait.
ESP, Nursing, Book 2. Unit 1, Nutrition. Exercise 5, page 5.
Proper nutrition. Having a healthy body requires getting enough vitamins and minerals. As such, it's important to know which foods to look for and which ones to avoid. Vitamin C and vitamin A are found in fruits and vegetables such as mangoes and broccoli. Fish, including tuna and salmon, are rich in vitamin D. Poultry and vegetables such as potatoes contain B vitamins. Many of these vitamin-rich foods have other important nutrients in them too. Fish, for example, also contains protein and omega-3, while zinc is found in most types of meat, including beef and poultry. A healthy diet will include a balance of these vitamins and nutrients. Some things should be eaten in moderation, though. While carbohydrates and fats are important sources of energy, eating too many is unhealthy. High fructose corn syrup, found in unhealthy items such as soda, has been linked to obesity in many studies. Limiting your intake of these items is important for your health.
Unit 2, Hygiene. Exercise 5, page 7.
Prevent the spread of disease. Use proper hygiene. It's easy to transmit diseases and infections when you don't use proper hygiene. Fortunately, using proper hygiene is easy. Just follow these simple rules. Wash your hands. Live viruses are often present on an object that a sick person has touched. Washing your hands removes the viruses you pick up in this way. Using antimicrobial soap makes hand washing even more effective. Use disinfectant in your home. Using a disinfectant to clean your kitchen and bathroom prevents the buildup of harmful bacteria. Apply antibiotic ointments as needed. When someone in your family gets a cut or scrape, use antibiotic ointment to clean the wound. Wear a face mask when working around sick people. Many diseases are transmitted through the air we breathe. Sometimes very sick patients need to be isolated. This usually only happens when the disease they have is easy to transmit and spreads rapidly.
Unit 3. Administering medication. Exercise 5, page 9.
Birmingham City Hospital. Prescription medication. For example, shots, tablets. The 5 rights. 1. Write medicine. Always cross-check with the head nurse on duty. Have him or her countersign the medication order when administering high-risk medicine. 2. Write patient. Never assume that the patient is in the correct room. Always look at the patient's identification bracelet before administering medication. 3. Write dose. Always double-check the dosage of the medication that you are giving your patient, as well as the expiration date. Warn patients of any possible side effects. 4. Write time. Always check the scheduled times for administration of medication to avoid accidental overdose. 5. Write route. Always obey the prescribed route of administration. Oral administration and intramuscular administration are not equal, and each prescription is given for a reason.
Unit 4. Admitting patients. Exercise 5, page 11.
Patient admission form. Patient to admit. Nicholas R. Foote. Biographic data. Date of birth. 5/4/1981. Marital status. Single. Chief complaint. Patient is experiencing constant severe pain in lower back. Over-the-counter medication is not significantly reducing the pain. Primary physician suggests he be hospitalized. Medical history. No previous history of back pain. Broken leg treated on 4/1/1990. Admitted 9/29/2001 for knee surgery. Family history. History of cancer on patient's father's side. History of diabetes and heart disease on patient's mother's side. Psychosocial history. Not applicable. Patient has had no treatment for psychosocial disorders. Allergies. Penicillin. Peanuts. Next of kin. Michael A. Foote, father. Insurance. First Californian Insurance Company. ID number UG 99120-24521. Advance directives. In the event that the patient is unable to make his own decisions, all decisions regarding the patient's medical treatment are to be made by his father, Michael A. Foote.
Unit 5. Taking vital signs. Exercise 5, page 13.
Patient condition check. Date, March 17th. Gloucester General Hospital. Patient name, Hannah Monroe. ID number, 5512. Sex, female. Room, 441A. Primary physician, Dr. James May. Attending nurse, Walter McCormick. Exam performed by Danielle Jones. Patient condition, stable. Patient vital signs. Body temperature, 100.6 degrees Fahrenheit as taken by oral thermometer. Heart rate, 81 beats per minute, resting rate. Blood pressure, 120 systolic over 80 diastolic as taken by aneroid monitor. Respiration. Exhibiting eupnea. Notes. No issues to report. Patient name. George Frank. ID number 9835. Sex. Male. Room 441B. Primary physician, Dr. James May. Attending nurse, Danielle Jones. Exam performed by Danielle Jones. Patient condition, serious. Patient vital signs. Body temperature, 102 degrees Fahrenheit as taken by oral thermometer. Heart rate, 120 beats per minute, resting rate. Blood pressure, 133 systolic over 98 diastolic as taken by aneroid monitor. Respiration, frequently exhibiting apnea. Notes, patient may need assistant of respirator.
Unit 6. Accidents, Emergencies, and First Aid. Exercise 5, page 15.
First Aid Guidelines. A seriously injured person needs immediate attention from paramedics or other emergency medical personnel. However, you can help the injured person before medical professionals arrive. First, check for responsiveness. If an injured person is unresponsive, check for breathing and a pulse. If these are missing, perform CPR. CPR consists of chest compressions designed to restart the heart and circulate oxygenated blood, and rescue breathing designed to provide oxygen for someone who cannot breathe on their own. If a defibrillator is available, this is an easier and more effective way to reset an abnormal heartbeat. Sterilize any open wounds that an injured person has and place a bandage over them. Look for blisters that indicate a first or second degree burn and cool them with cold water or ice. For those in shock, elevate their feet, cover them with a blanket, and get help. People with serious injuries such as third-degree burns require painkillers like morphine and other treatments that you cannot provide. Wait with the injured person until help arrives.
Unit 7. Wound Care. Exercise 5, page 17.
Lincoln County Medical Center. Monitoring your wound. Your nurses will dress and check your wounds frequently, but you can help them by watching out for these serious developments around your injury. Necrosis. Necrosis is the death of tissue caused by infection, trauma, or toxins. Watch for eschars or sloughs of dead tissue that have fallen from the skin. The dead tissue requires debridement, and the cause of the necrosis needs to be treated as soon as possible. Maceration or desiccation. Skin needs to be kept from getting too wet or too dry. In the case of maceration, look for skin that is unusually soft and white. This means that it is being kept constantly wet. For desiccation, watch for skin that is dried out, causing cracking and bleeding. Cellulitis. Cellulitis is the inflammation of connective tissue and skin. It commonly occurs where the skin has been broken, such as areas near sutures. Cellulitis may include an exudate that needs to be drained.
Unit 8. Medical Specimens and Testing. Exercise 5, page 19.
Redwood Medical Center. Medical Report CKD Test Analysis. Patient name Toby Brown. Suspected condition chronic kidney disease, CKD. Lab tests conducted on April the 9th. Patient complained of lack of energy and decrease in appetite. Patient has a family history of kidney problems. Standard tests for renal function were conducted. Lab tests suggest that the patient's blood pressure is at the high end of the normal range. Results show a reading of 130/90. A urinalysis reveals a high level of albumin present in the patient's urine. A blood test revealed that creatine levels are slightly elevated. These results suggest patient may be in the early stages of kidney disease. The next step is to order a GFR test and a BUN test. A biopsy may also be necessary to determine the cause of the kidney disease. The pathology report should be sent immediately to Suite 203 on the second floor. Kidney, chronic kidney disease. Stages of CKD. Stage. Description. GFR, ml, min, 1.73 meters squared. Symptoms and signs. 1. Kidney damage with normal or increased GFR, greater than or equal to 90. BP plus minus. 2. Kidney damage with mild GFR fall, 60 to 89. BP lab plus minus. 3. Moderate fall in GFR, 30 to 59. BP lab plus, symptoms plus minus. 4. Severe fall in GFR, 15 to 29. BP lab plus plus plus, symptoms plus. 5. Established renal failure, less than 15 or dialysis. BP lab plus plus plus, symptoms plus plus.
Unit 9. Discharging Patients. Exercise 5, page 21.
Crawford Hospital, Hospital Discharge Summary Form. Patient name, Matt Clark. Date of admittance, February 15, 2010. Date of discharge, February 17, 2010. Discharge planner, Amy Grant. Reason for admittance, patient suffered severe asthma attack. Patient received oral medication and a chest x-ray. Home care, bed rest for 1 full day. Patient should avoid heavy physical activity for at least 1 week. AIDS, patient will receive a metered dose inhaler to take home. Patient will also be sent home with a nebulizer in case of more severe asthma attacks. Follow-up, patient should make an appointment with his primary care doctor for a follow-up visit in 2 weeks. Existing services, patient is currently receiving weekly physical therapy for a previous knee injury. The physiotherapist providing the care is Dr. Kemp. Additional notes. Insurance. Coverage for patient's hospital stay is 100%. Coverage for hospital aids is 80%. Transportation. Patient's daughter, Sarah Clark, will pick up patient at 4:15 p.m. at the East Wing entrance.
Unit 10. Maternity Nursing. Exercise 5, page 23.
Greenville Health Clinic for Women, the 3rd trimester, and signs of labor. Women in the end stages of pregnancy often wonder if certain movements mean they're starting labor. Yet, there are many occurrences that just mean your baby is moving and healthy. In the weeks before labor, lightening may occur. Women often feel more pressure near the pelvis after this. You may also notice an increase in discharge or bloody show. This does not mean labor has started. When labor does start, your contractions may become stronger. Do not confuse labor with Braxton.
Newborns. Common illnesses. Remember, not every illness requires a doctor's visit. Review the following common illnesses to know when you should or shouldn't bring in your new son or daughter. Jaundice occurs in almost half of all babies. It is caused by elevated levels of a chemical called bilirubin in the baby's blood. This results in yellowing skin. Most cases are resolved with phototherapy. Mild jaundice may be treated with sunlight. Serious cases, in which a baby's entire abdomen or eyes appear yellow, require hospitalization and biliolights. Erythema toxicum is a bumpy rash that develops on most babies. It is usually harmless and should disappear within a matter of days. Schedule a visit if it remains for longer than a week. Oral thrush is a painful irritation marked by sores and a white film in a baby's mouth. It is caused by a yeast infection, which newborns' undeveloped immune systems cannot combat. As such, it requires immediate professional treatment.
Operating room preparation and surgical procedures. Surgical nurse shifts begin approximately 1 hour before the first scheduled surgical procedure. Please see that the operating room is fully prepared 15 minutes prior to use. When it is ready, notify Dr. Jenkins, operating room coordinator. Always follow these steps to ensure the safety and health of both patients and staff. 1. With the assistance of cleaning staff, ensure that the room is sterile. 2. Gather and sterilize all surgical tools, including scissors, forceps, retractors, and scalpels. 3. Set up sterile table with tools, sponges, towels, and medications. 4. Stock the scrub room with bactericidal soap, gowns, gloves, hairnets, masks, and shoe covers. 5. Assist the surgeons in scrubbing and gowning. 6. Pass tools to the surgeons during operations. After each procedure, transport the patient to the post-operative unit. Then work with the cleaning staff to clean and sanitize the operating room and all equipment.
Arbor Home Health Care. At Arbor Home Health Care, we know that an illness or injury can make even simple tasks seem impossible. We also understand that comfort and happiness aid recovery. That's why our trained and licensed nurses come to assist and treat you where you're most comfortable, at home. We offer a range of services. Medication. We work with your physician and pharmacy to pick up and administer prescriptions. Injections. Nurses can provide single injections or infusion therapy. Wound care. Our nurses will help you clean and bandage your wound to ensure proper healing. Personal care. We will assist you with mobility, bathing, and grooming. Household assistance. We can help with chores and meal preparation. Advocacy. Our nurses can accompany you during appointments to help you understand options and make decisions. Arbor Home Healthcare accepts most major insurance providers. For out-of-network patients, our friendly administrative staff can negotiate lower rates for most services.
Lamont University Public Health Fair. Welcome to the annual Lamont University Public Health Fair. Today's keynote speaker will be Karen Netherwood, MSN. Ms. Netherwood will address the role of public health nurses in shaping government policies. We will also have several other speakers from the field of public health nursing. We hope you can join us for all of these informative discussions. Schedule of events. 9 a.m. Responding to Epidemics with Stephen Landers, MD. Dr. Landers will discuss epidemics and preventative measures in large populations such as cities, states, and countries. 11 a.m. Infectious Diseases, a 21st Century Perspective with Barbara Johnson, RN. Ms. Johnson will present recent statistics on communicable diseases from the CDC. She will also talk about effective methods of prevention in densely populated urban areas. 12 p.m. Lunch. 2 p.m. Workshop on outreach within homeless communities. Gloria Escher, MSN, will moderate a dialogue about successful techniques for treating outbreaks among the homeless. 5 p.m. Keynote address with Karen Netherwood, MSN.
Worldwide Nursing Network. Begin a new career today. The Worldwide Nursing Network, WNN, can help you find international nursing jobs. We work with over 500 employers in 15 countries to find positions for our clients. A variety of exciting full-time, part-time, and per diem jobs are available. We specialize in travel nursing assignments for those that want to experience a variety of locations. Qualifications: nursing degree, associated or bachelor's, and license. At least 1 year of clinical experience. If you meet these requirements, WNN will open your account free of charge. Just fill out the application at the bottom of this page. Then, one of our associates will contact you to discuss your situation and goals. There's no fee unless you're successfully placed. After we place you in a job, our immigration specialist will work with you through every step of your transition. Getting a passport, obtaining a work visa, finding temporary housing. Don't wait. Contact us right now.
ESP Nursing, Book 3. Unit 1, Schedules and Hours. Exercise 5, page 5.
The Daily Post, March. Overworked nurses. Low pay, high stress. The findings of the latest Daily Post survey are startling. Over 50% of Springfield County nurses feel overworked. The survey asked 300 full-time and part-time nurses to rate their work experiences. The results reveal that the majority of nurses work long shifts with few breaks in between. Most reported feelings of fatigue and lack of energy. Nurses cited several reasons for this exhaustion. Low pay drives nurses to work longer hours to earn overtime pay. Furthermore, high stress on the job leads many nurses to retire early, which increases strain on the current workforce. And although demand for nurses is high, few hospitals have the budget to hire more. The dangers of such strain are obvious. Low energy and tiredness can negatively affect job performance and put patients at risk. But the surveyed nurses also offered solutions to these issues. Among their suggestions is providing financial incentives to prevent early retirement. Also suggested was an increase in part-time positions to reduce stress on nurses working long hours. Finally, a majority of nurses requested shorter shifts with lighter workloads to prevent exhaustion and on-the-job errors. And they want these changes soon. According to the nurses, delaying these improvements threatens the well-being not only of medical providers, but that of patients too.
Unit 2, Communicating with Patients and Families. Exercise 5, page 7.
Hayward Health Clinic Memo. Subject: Communicating with Patients. Nurses, as you know, clear communication is vital to providing the best care possible. However, it seems that as of late, we are not getting all the information we need. If you suspect you are not getting enough information from a patient, remember some of the possible causes of such miscommunication. Poor health literacy. Uninformed patients may not understand key terms. Negative preconceptions. Patients may not trust medical professionals or may experience anxiety. Cultural differences. Different cultures may have different approaches to dealing with illness. If you recognize any of these issues, a few simple steps can be taken to help improve communication. Establish a good rapport. It's very important to the therapeutic process. Show empathy. Be aware of how your verbal and nonverbal cues affect the interaction. Don't use too much jargon, since this may confuse or intimidate your patient. Ask open-ended questions to help signal to patients that you care about their input. Remember, you are our first and most important line of communication to patients. The more information we can give and receive, the better care we can provide.
Unit 3, Chronic versus Acute Conditions. Exercise 5, page 9.
Chronic and acute illnesses, the dangers of late intervention. Many people who experience an illness feel no need to seek immediate treatment. They may believe that they will get eventually better, or that any pre-existing medical conditions they have will not worsen in the presence of another illness. But such thinking is dangerous. Both chronic and acute illnesses that are left untreated can grow more severe. and they can lead to even more serious complications down the road. In chronic conditions, early intervention is vital. Insufficient treatment can actually result in the occurrence of a debilitating acute condition. For instance, osteoporosis that is not properly managed can lead to broken bones. Likewise, chronic bronchitis that is left untreated increases the risk of dangerous respiratory conditions like pneumonia. And hypertension left unchecked can result in a deadly stroke. Similarly, delaying treatment of acute conditions can cause the onset of chronic ones. For example, a bout of scarlet fever, caused by the strep virus, can lead to endocarditis. Not treating the fever in time can create life-threatening and long-term problems. But there is good news. Visiting a doctor in the early stages of an illness can help you avoid serious complications later. Seeking treatment early on can save time, money, and possibly even your life.
Unit 4, Diabetes. Exercise 5, page 11.
About diabetes. Type 1 diabetes. Once known as juvenile diabetes, type 1 diabetes mostly affects children and teens whose bodies are unable to make insulin. 10 to 15% of people with diabetes have type 1 diabetes. Type 2 diabetes. Type 2 diabetes is the most common form of the disease. It results from poor insulin production or from insulin resistance. Gestational diabetes. 4% of pregnant women are diagnosed with gestational diabetes. After birth, blood sugar tends to return to normal, but the patient has a greater risk of later developing type 2 diabetes. Causes. 1.6 million new cases of diabetes are diagnosed each year. There are certain risk factors for developing type 2 diabetes: genetics, race, a high BMI, inactivity, high blood pressure, high blood fat levels, gestational diabetes, a diet high in fat or alcohol. Complications. Diabetes reduces blood flow around the body. It leads to problems with the eyes, feet, kidneys, nervous system, skin, digestive system, sexual function, teeth, and gums. It can result in heart attacks, strokes, cataracts, glaucoma, blindness, and even amputations. Treatment. For these reasons, it is crucial to manage diabetes. Treatment plans are tailored to each patient to help keep glucose levels within a target range.
Unit 5, Cancer. Exercise 5, page 13.
Cancer treatment options. A cancer diagnosis can be overwhelming, but there are now many treatment options. Your oncologist may suggest one or more of these therapies. Chemotherapy. Chemotherapy, or chemo, is a drug or combination of drugs that kills cancer cells. It can be taken orally as a pill or liquid, or as an injection. The most common delivery method is an IV. Chemo can be received in a hospital or outpatient setting. Your doctor may prescribe chemo before or after surgery. Talk to your doctor about potential side effects. Radiation therapy. Radiation, also called radiation oncology, destroys cancer with high-energy X-rays. It works best on cancer cells that are splitting very quickly. It impairs the cancer cell's DNA so that it cannot grow or divide. Immunotherapy. Immunotherapy boosts the patient's immune system. Antibodies are made in a lab and then introduced to the patient's system. They target the cancer cells and kill them. Immunotherapy is also a means of conveying poisons straight to cancer cells. Photodynamic therapy. Photodynamic therapy uses drugs and light to kill cancer cells. Anti-angiogenesis therapy. Tumors need a blood supply to survive. Anti-angiogenesis stops a tumor from making new blood vessels so that it cannot grow.
Unit 6, Heart Disease. Exercise 5, page 15.
What is heart disease? Types of heart disease. Cardiovascular heart disease is the leading cause of death in the U.S., but many people know little about it. Heart disease is a term that covers several problems that can affect this vital organ. Coronary artery disease, heart failure, and congenital heart disease are all forms of heart disease. Prevention. Simple measures can reduce your likelihood of getting heart disease. Stop smoking. Exercise. Eat a heart-healthy diet. Maintain a healthy weight. Abdominal obesity is linked to heart disease. Reduce stress. Get checkups and screenings. Treatment. Coronary artery disease can be treated with an aspirin regimen, ACE inhibitors, or beta blockers. Treatment plans may involve lowering high blood pressure and cholesterol. Surgical options include installing stents or performing open heart surgery to bypass plaque buildup in the arteries. Heart failure occurs when the heart has trouble pumping blood around the body. This condition is treated with drugs to help the heart function correctly. Surgical options include the installation of a pacemaker or, in some cases, a heart transplant. It is important to take good care of your heart. Be sure to follow the methods for prevention and get regular checkups from your doctor.
Unit 7, Trauma and Triage. Exercise 5, page 17.
The ESI triage system. Purpose of the system. Hundreds of trauma patients enter a hospital's emergency department each day. These patients' ailments range from fractures and compound fractures to severe burns. Since the acuity of their conditions can vary greatly, it is necessary to prioritize patient care. The Emergency Severity Index, ESI, triage system allows nurses to quickly assess a patient's condition. This helps nurses determine the order in which to treat patients. How it works. When patients enter the emergency department, nurses must assign them to an ESI level. You must first determine if a patient is in danger of dying immediately. Such patients are assigned to ESI 1. This level is reserved for patients needing immediate life-saving treatment. If the patient is not dying, you must decide how long the patient can wait for treatment. Patients needing immediate treatment are assigned to ESI 2. However, many patients are not critically ill and are able to wait for care. For these patients, nurses should estimate how many resources they will likely require. Patients requiring multiple resources are assigned to ESI 3. Patients who are likely to need only one resource are assigned to ESI 4. Finally, patients who need no resources at all are assigned to ESI 5. Emergency Care, page 52.
Unit 8, Communicating with Staff. Exercise 5, page 19.
Dear staff, concerns have been raised about the communication lagging when shifts change. Medical records are not currently being filled in correctly, meaning that nurses who are starting their duties are ill-informed about the patient's current status. This lack of communication is putting patients at risk. I would like to take this opportunity to highlight the processes which you must adhere to when you change shifts. Please make sure you update all medical records. All records must be listed in chronological order. Make sure you document all medication that the patient has received and make a full assessment of the patient's current status. Make sure the patient's plan of care is clearly stated. Make sure your records are comprehensive. Do not leave out any important details. However, records must also be concise. Avoid unnecessary wordiness. You must ensure that you write legibly, as there have been recent problems reading illegible handwriting. Use all capitals if your cursive is messy, and only use approved standard abbreviations. Observe these guidelines every time you complete your shift. Thank you in advance for your cooperation. Lindsay Davies, Head Nurse.
Unit 9, IV Care. Exercise 5, page 21.
IV Summary. Patient name, Carlotta Salinas. Solution, hypotonic saline. Infusion rate, direct infusion. Set clamp to 140 milliliters per hour. Cause for IV. Miss Salinas has diabetes and has become dehydrated as a result of high glucose levels. Notes. Watch for infiltration where IV drip is inserted. Notify MD immediately if this occurs. IV Summary. Patient name, Mark Smith. Solution, isotonic saline. Infusion rate, intermittent infusion. Set roller clamp to 150 milliliters per hour microdrip. Cause for IV. Mr. Smith is severely dehydrated due to gastroenteritis and requires an isotonic saline solution to restore normal fluid levels. Notes. Check patient for signs of dehydration hourly. Reduce to 75 milliliters per hour macro drip when symptoms fade. Watch for signs of diarrhea and vomiting. IV Summary. Patient name, Raymond Willis. Solution, hypertonic saline. Infusion rate, continuous infusion of nutrient solution through IV pump. Set clamp to 50 milliliters per hour. Cause for IV. Mr. Willis is unconscious with a head injury and requires parenteral nutrition. Notes. Check IV site regularly for signs of infection. If patient returns to consciousness or shows any signs of sickness, fever, or altered heart rate, inform MD immediately.
Unit 10, Preparing a Patient for Surgery. Exercise 5, page 23.
Pre-op checklist. This pre-op checklist details all forms and tasks that are necessary in order to proceed with scheduled surgery. The form is to be completed by the attending nurse. Initial each task on the left to indicate its completion at least 1 hour prior to the patient's scheduled surgery. Sign and date the form at the bottom. Patient history and physical exam performed. Operative permit signed by patient and witnessed. Anesthesia permit signed by patient and witnessed. Medication reconciliation form signed by patient and physician. EKG report present in patient's medical file. Patient given NPO order. Yes or no? If yes, specify number of hours that have elapsed since NPO. Post-op room confirmed. Yes or no? If yes, specify ward and room number. Chlorhexidine bath scheduled to be given prior to surgery. Information on identification bracelet double-checked. Known allergies indicated on patient's identification bracelet. Fully stocked crash cart present in surgery room. Patients informed of personal effects policy including jewelry, glasses, watches, and hair accessories. Signature, date.
Unit 11, Preventing Infection. Exercise 5, page 25.
5 steps to preventing infection. 1. Hand hygiene. Your hands are the most common vectors for spreading nosocomial infections. Regular hand washing can reduce contamination considerably. Use the alcohol-based hand sanitizers located throughout the hospital to reduce outbreaks of E. coli or staph infection. Be aware that not all pathogens are killed by alcohol-based sanitizers. Use soap and water when caring for patients with the pathogen C. diff, for instance, and ensure that all visitors do the same. 2. Use checklists. Use checklists to ensure that procedures are completed accurately. If patients are fitted with unnecessary tubes, such as urinary catheters, infection can ensue. Keep checklists to clarify what has been fitted. 3. Kits. Keep kits to hand which contain all the equipment needed for common procedures. You don't want to be running to the supply closet mid-procedure for something that you have forgotten. 4. Oral hygiene. One of the most common infections in intensive care units is ventilator-associated pneumonia. Keep bacteria levels low by regularly cleaning the patient's mouth, gums, and teeth. 5. Diagnostic tests. Be vigilant and look out for patients showing signs of infection. Use quick diagnostic tests to identify patients with infectious diseases, such as MRSA. If patients who show symptoms are rapidly tested, the risk of spread is reduced.
Unit 12, OB/GYN, Nursing. Exercise 5, page 27.
Adjusting to menopause. Although menopause signifies an end to a woman's reproductive years, it is nothing more than a natural transition that is part of every woman's life. Knowing the signs of the process can help prepare you for this change and prepare for life after. Perimenopause. Menopause will not arrive suddenly. Rather, over a period of years, starting in the late 30s to 40s, your body will gradually reduce production of estrogen and progesterone. This time, typically lasting between 2 and 10 years, is called perimenopause. Symptoms include irregular menstrual cycle, hot flashes, insomnia, reduced libido, limited fertility. There is no real need to see a physician for perimenopause symptoms, unless they are interfering with your daily life. In such cases, your medical provider may choose hormone therapy to reduce their impact. Menopause. Menopause officially occurs when a woman has not had a menstrual cycle for 12 months. At this point, her ovaries have exhausted their supply of eggs and the uterus no longer forms new linings. In addition to these reproductive changes, menopause also puts women at risk for bone loss. For detailed information about transitioning to menopause, schedule an appointment with a provider in the OB/GYN department.
Unit 13, Geriatric Nursing. Exercise 5, page 29.
Grace Nursing Home. About us. We at Grace Nursing Home are dedicated to providing the highest level of care to our patients. Our staff includes over 20 highly skilled nurses specializing in geriatric care. Unlike most assisted living facilities, Grace Nursing Home provides 24-hour supervision and assistance to our patients. Our care. Grace Nursing takes pride in providing the very best care. Our nurses are trained to recognize and treat a wide variety of conditions. We closely monitor patient medication to prevent polypharmacy problems, including harmful drug interactions that can lead to dizziness, falls, or strokes. We provide our patients with top-quality equipment and products, such as mattresses that help prevent bed sores. We offer a variety of activities and services to keep our patients healthy and happy. Our patients. At Grace, we care for and treat patients with a wide range of medical problems from immobility to incontinence. Some patients need only moderate assistance, such as those with hearing loss. Others require closer supervision, such as those suffering from Alzheimer's disease. The patients at Grace may differ in their needs, but they all come here seeking the same thing: reliable, top-rate care. If you or your loved one is looking for such care, contact Grace today.
Unit 14, Psychiatric Nursing. Exercise 5, page 31.
A challenging career, psychiatric nursing. If you would like to specialize in one area of nursing, psychiatric nursing could be the right thing for you. It's a growing field, and nurses work in a wide range of locations using surprisingly diverse therapies. Psychiatric nursing is the care of people with mental illnesses. Such problems may include dementia, schizophrenia, bipolar disorder, eating disorders, depression, and addiction. Nurses use the DSM-4 as their main reference source. Nurses may work in a hospital setting, But they are also likely to meet patients in their own homes or even in prisons, as many nurses are involved in the rehabilitation of those who have been hospitalized or imprisoned. Psychiatric nursing involves a range of different interventions. Nurses need skill in the administration of medicines, both orally and through intramuscular injection. Nurses may also treat patients using electroconvulsive therapy. Nurses may also be involved in delivering psychotherapy to aid patients' recovery and manage any future crises in their medical health. If you would like any further details on a career in psychiatric nursing, please contact Wendy Stevens at the Center for Psychiatric Training at w.stevens@cpt.org.
Unit 15, Hospice Nursing. Exercise 5, page 33.
Vernon Hospice Care. About us. Vernon Hospice Care is a full-service provider of end-of-life care. We know there is no more difficult time for patients or their families. Our compassionate staff will be there to make sure that you or your loved ones are as comfortable and prepared as possible. Who do we care for? Vernon Hospice Care only assists patients afflicted with a terminal disease and who have a life expectancy of 6 months or less. What do we do? Hospice care provides palliative measures. It is important to note that such measures do not include euthanasia, though DNR orders are always honored. Within a strict legal and ethical code, Vernon Hospice staff does everything possible to make patients comfortable and relaxed. We assist patients and families with medication, mobility, meals, and medical decisions. We know that our patients have much more than medical needs, and so we also attempt to relieve emotional stress as well. To that end, we provide therapy, as well as planning for funerals, burials, and cremations. Likewise, we handle remains and arrange for prompt delivery of a death certificate after a patient passes away. Making these decisions and plans ahead of time often helps patients feel prepared and allows families to grieve in peace.
AVN Pharma Education.